Namaste. I'm Sudipna. Welcome to today's topic, which is complication and conditions during each trimester. You might find that there are many conditions that we have already discussed in previous chapters, but I would like to re-review them from a point of view of connecting it to each trimester and understanding some symptoms that can ultimately lead to a certain condition. And catching certain symptoms early on may prevent miscarriages or some danger to the baby and the mother. And also understanding them once again will really help you to understand the seriousness of certain symptoms that shows up even during a yoga class. And a minor thing might change into a bigger issue. So how much precaution you have to take while teaching mothers, and the sensitivity of dealing pregnant women will heighten by understanding these conditions that occur during each trimesters. So I hope this will help, and let's go into details. So let's understand the first trimester. So the first trimester of pregnancy spans first to 12 weeks of pregnancy, and it's a time of significant changes in the mother's body. And these changes are mainly due to hormonal shifts that trigger symptoms very early on and cause the cessation of the menstrual cycle. So some common physical and emotional changes experienced by women during this period include fatigue, breast tenderness, swelling, nausea or vomiting, food cravings or aversions, mood swing, constipation, frequent urination, headaches, and fluctuation in the weight. So during the first trimester, the baby's development is also very crucial. And this is a time when the organs begin to form and mature. And by the end of the first trimester, all organs should be fully developed in the normal pregnancy. And it's important for the mothers to take really good care of themselves during this time in order to support their own health as well as of the developing baby. And throughout the first trimester, hormonal changes plays a major role in both mothers and the baby's development. For the mother, these shifts can trigger a range of physical and emotional symptoms, while for the baby, they really help ensure that all the organs are formed and functioning proper. However, it's really worth noting that every pregnancy is unique, and not all women will experience the same symptoms or have the same outcome. So to really ensure that the baby is healthy and to prevent neural tube defects, it is crucial for the mother to follow a very healthy diet with sufficient amount of folic acid during the first trimester. Now, miscarriage is more likely to happen during the first trimester, and there are certain basic things that can help avoid that. Number one would be having prenatal supplements or vitamins. The next would be avoiding any kind of medical prescription that is not suitable for pregnancy. In that case, the women really need to consult to their medical professional or doctors to know which medication they have to discontinue while being pregnant, because they can cause miscarriages quite often. Now, there are major dietary shifts that can occur in some women cases, and some women might not require to do many changes in their diet. Women that constantly consume too much caffeine can damage the fetus development and the baby, especially during the first trimester. So caffeine reduction is the crucial point. Eliminating red meats, etc., and shellfish. And there are other fishes which have high amount of mercury and lead. All those can lead to miscarriages. And there are serious pregnancy complications and birth defect that can be caused by smoking, alcohol, also. So it becomes very, very crucial that they immediately stop smoking and alcohol if they have been consuming it prior to pregnancy. Of course, what can be better is that they stop consuming it the moment they plan for conception. But if not, the moment they have the news that they have conceived, it's required to be stopped on immediately basis in order to avoid any risk to the baby or development issues for the baby. Now, other complications that could arise in the first trimester will be bleeding or hyperemesis gravidarum, which is excessive vomiting, and spontaneous abortions or miscarriages are also very common, as we discussed. One other issue that is common is ectopic pregnancy and molar pregnancy. And these complications we'll actually discuss in the detail. So, bleeding is the first issue that can occur. So, minimal bleeding or spotting can be there in the first trimester, but it's really crucial to take the symptoms very seriously, as it can be really challenging to know whether it indicates a more severe problem or it's just normal spotting. So in some instances, bleeding could be an indication of an impending miscarriage, and if the woman experiences vaginal bleeding, she should consult with her doctor to make sure nothing more serious is going on. Second would be severe vomiting. So vomiting is a typical experience for many women during the first trimester due to BSCG hormone, and this hormone stimulates the CTZ center in the brain, which triggers vomiting. So while vomiting is a very common symptom, but if it becomes persistent and severe, it could prevent the mother from getting the necessary nutrition and fluids, which could put both mother and baby in the danger. So if a woman experiences persistent and excessive vomiting, it's critical to see a doctor and receive appropriate treatment immediately to avoid massive dehydration or any damage caused to the baby or the mother herself. Now, spontaneous miscarriage or abortion is also quite common in this first trimester, and it occurs when the pregnancy termination is not induced voluntarily before viability. That means there was the women who have, let's say, no prior. That means that without intervention, the baby died without any medical intervention or an action to do. So next would be spontaneous abortion or miscarriage. So spontaneous abortion, also known as miscarriage, occurs when pregnancy termination is not induced voluntarily before the viability of the pregnancy. So before, when the women who have no history of spontaneous abortion are approximately 15% likely to have one. So, but the risk increases if they have had one or two, any number of abortions before. So the symptoms to look out for includes lower abdominal cramps with backache, vaginal bleeding or discharge, uterine contractions, or excessive nausea or vomiting. This could be caused by genetics and specifically chromosomal abnormalities as well as endocrine causes. That includes progesterone hormone deficiencies and uncontrolled diabetes, some kind of infection, abnormal placental implantation, where the baby plants itself in an abnormal position, etc. So all these are common causes of spontaneous abortion. Now coming on to ectopic pregnancy. So ectopic pregnancy, this occurs when implantation happens outside the uterine cavity, usually in the fallopian tube. So we discussed in the anatomy about the fallopian tube, and sometimes the pregnancy, rather than the zygote traveling all the way to the uterine line, sticks to the fallopian tube itself. And if that happens, that particularly, it is called ectopic pregnancy. And that causes severe abdominal pain whenever that occurs. And ectopic pregnancy is literally an emergency and must be dealt as quickly as possible. And the key sign, once again, to watch out would be lower abdominal pain, excessive pain on either of the sides, or a sudden onset of cramping, possibly fainting sometimes, and repeated periods of severe abdominal pain once again, or vaginal bleeding, increased urinary frequency with burning sensation, multiple missed periods, and a fever. And with prompt diagnosis and treatment, many ectopic pregnancies can resolve on their own with the treatment and surgery. So, next common symptom condition is fatigue. So, excessive tiredness due to hormonal changes and increased energy demands can cause a lot of fatigue for the women during the first trimester, which is a common condition, but for some women it can be really excessive given their history of how nutritionally well versed they have been in the past, how much energy they carry in their body otherwise, or if they have had any medical history or issues that is causing extreme tiredness and their body is not able to cope up with the fast changes that is occurring due to the baby developing. So it's really required that the women that is experiencing excessive fatigue should be given as much as rest possible. And if they end up in your yoga class, you should only give very slight asanas that will just relax their body more, or some restorative asanas. And what can be done is help them lie down on their side with boosters and allow them to listen to yoga nidra or some guided meditation. That would help them release excessive stress from the bodies and deal with the fatigue. Molar pregnancy is another condition, and it happens as a result of abdominal development of the cells in the placenta that cannot support the growing embryo. Molar pregnancies are caused by chromosomal abnormalities in the sperm that fertilizes the egg, and or both happens. So sometimes it can fertilize the sperm or the egg. But this is called not as a natural process, but as chromosomal abnormalities. And the risk of having a molar pregnancy can be increased by becoming pregnant at higher than 40 years of age. And ethnicities such as Asians, African Americans have the highest incidence rate of malnutrition, protein deficiencies, and previous occurrences of molar pregnancies. So symptoms to watch out for would be irregular periods for 3 to 4 months, brown or prune-colored bleeding, or excessive vomiting. Increased urination is another condition. So frequent need to urinate due to increased blood flow in the pelvic region is a very common condition, but it does not usually require any medical attention as long as there is not any burning sensation in the urine. If it's just a frequent need to urinate, that is fine as long as it doesn't have burning sensation or any other infection symptoms. Now, changes in the breast is also that occurs during the first trimester. So breast begins to enlarge, and some tenderness can be felt by the mothers, and their areolas, the circle around the nipples, that is the area which is called areola, begins to darken spontaneously. Let's move on to second trimester. So the second trimester spans from week 13 to week 28 of the pregnancy, and it brings the relief for most mothers as the symptoms of nausea and fatigue starts to fade down during this period. However, the baby continues to grow and the abdomen begins to expand, and the body will need to make the adjustments to accommodate the increasing size of the baby. And consequently, mothers may also experience a range of physical discomfort, and around this time, she might have increase in body aches, some stretch marks can occur, a dark line on the skin running from the belly button to the pubic hairline can appear at this stage. Some dark patches of skin on both sides of the face can also occur for some women. Carpal tunnel syndrome also is a common issue that is seen during the second trimester that leads to numbness or tingling in the hands. Itching and swelling of the fingers can also be seen, or sometimes itching and swelling can be seen in ankles and face also. And despite these discomforts, many women find the second trimester more manageable than the first. And additionally, the baby's movement become more noticeable during this trimester, and this provides a very exciting time and opportunity for mothers to connect to their growing baby. And as the baby's ears continue to develop, they can hear and recognize the mother's voice. That allows an even deeper bond to form between the mom and the baby. And it is also important to note that while the second trimester is generally less symptomatic, like there are less symptoms in terms of medical conditions than the first, but it's really crucial for the mothers to prioritize and continue to take care of their health during this trimester also. Even though major risk of miscarriage has passed, but we should not take it lightly that we ignore our diet or hydration at any point in time. So balanced diet and staying hydrated, continue to engaging in light exercises will really help elevate any discomfort and promote a healthy pregnancy and continue to keep the mother and the baby healthy. Mothers should also really continue to attend, the doctor checkups and continue to do activities that support their mental and emotional health, well-being also. Could be yoga, meditation, etc. Now, coming on to particular conditions that are more serious in this time, and one would be gestational diabetes, and it's a condition that affects some pregnant women, causing their blood sugar levels to become elevated during the pregnancy, and this condition can lead to complications for both mother and baby if it's not managed correctly. Gestational diabetes is typically diagnosed through a glucose screening test, which involves drinking a sugary drink and then having your blood sugar levels tested. If your blood sugar levels are high, your doctor, like the mother's doctor, may recommend further testing to determine if they have gestational diabetes. And if the mother is diagnosed with the gestational diabetes, then the doctor will usually work with them to create a plan that will help them manage the blood sugar level. And this might include some changes in the diet or exercise routine, or if required, they might introduce some medications such as induction of insulin in the body, inducing insulin. So it's essential to really follow the treatment if the mother has got one, and plan closely on their diet and exercise routine to really ensure that both the mother and the baby remain healthy throughout the pregnancy, and avoid any potential complication that can arise due to the presence of gestational diabetes. And for the mother, the complication that can further occur due to the presence of gestational diabetes may include, preeclampsia, which is potentially a life-threatening condition that involves high blood pressure. Sometimes it can lead to cesarean delivery, and and increased risk of developing type 2 diabetes later in life. And for the baby, the complication may include macrosomia. Macrosomia is a condition in which the baby grows too large, which makes the delivery more difficult. Now, hypoglycemia is another condition, which is low blood sugar and increased risk of developing obesity and type 2 diabetes later in life that are also followed up kind of consequential symptoms of gestation diabetes. But fortunately, we have systems at place, and if the mother do proper management of the gestation diabetes, the risk of complications can be minimized, and this might require her to do regular monitoring of her blood sugar levels and follow a strict healthy diet or an exercise routine, and taking any medications if the doctors have prescribed. And it's also essential to, that the woman is constantly communicating to her doctors and healthcare providers whenever required, and whenever any symptoms that are not comfortable to her body are shown in the body. So, placenta previa is another common condition that we experience around this time. And placenta previa is a condition that occurs when the placenta partially or completely covers the cervix during pregnancy. So this can lead to bleeding and other complications that can be serious for both mother and the baby. So the placenta is the organ that develops pregnancy and provides essential nutrients and oxygen to the developing fetus. And it typically attaches to the uterine wall and is located near the top of the uterus. And it's little away from the cervix. So, however, in some cases, the placenta may implant near or over the cervix. That leads to placenta previa. So, the most common symptoms of placenta previa is like painless bleeding during the second or the third trimester of the pregnancy. However, some women may not experience any symptoms at all. So if the mother experiences any bleeding during pregnancy, it's really important to right away contact the doctors. And if placenta previa is diagnosed, then the doctors will require to monitor her condition very, very closely to ensure that the baby remains healthy throughout the remainder of the pregnancy. And depending on the severity of the condition, doctor may recommend that bed rest or other restrictions may be advised, such as sexual activities, avoiding sexual activities that could cause further bleeding. In some cases, placenta previa may resolve on its own as the uterus grows and the placenta moves away from the cervix. However, in some cases, the condition may persist and may require the delivery only by C-section and cesarean to avoid any complications to the baby. And this is because vaginal delivery with placenta previa can be very, very dangerous and can result in heavy bleeding that can be life-threatening to both the mother and the baby. And several potential complications can also arise with placenta previa, including preterm birth, low birth weight, and an increased risk of infection. But if it recognized in time that the woman has a condition of placenta previa, a proper management and monitoring can be done to help her avoid any complications and minimize the risk in future. And most women with placenta previa go on to have like healthy pregnancy and delivery, but a lot of care is required. Now to just give you a short review. So cervix is where the vaginal opening is. So for example, ideally we would want the placenta to be placed around your breast area, which is like, the above, just below your breast. But if it's other way around, that means around the opening of your vagina, that's not where we want the placenta to be placed, because that puts the risk of placenta to, not allow the baby to be delivered properly, or there are so many other risks that we discussed right now. So this becomes very, very crucial that if you have a student with this condition, there are what should be avoided utmostly is no squatting postures at all. Whatever requires them to open their thighs too much, put a lot of pressure of any kind on the pelvic region, that's not what we want to do when they have a condition of placenta previa specifically, because that can lead into bleeding. While we will do asana series, in each asana, I have explained in which condition that asana should not be done. But just to give you still a gist of it, any squatting asanas, anywhere you're opening your thighs, is not recommended for the women with the placenta previa condition. Now, moving on to another is preterm labor is also a condition where my apologies, looks like a slide is missing here where the placenta previa and the preterm labor is not there, but since I have recorded that in the lecture, so you can we'll add it in the presentation, which you can download. But here you can refer to my the way I'm speaking and understand it from there. So please, we have just discussed about placenta previa. The next thing is preterm labor, and the preterm labor refers to onset of labor before 37 weeks of pregnancy, and it's a serious condition that can lead to complications for both the mother and the baby. And it's important to be aware of signs and symptoms. And the signs and symptoms of preterm labor. Preterm labor means a labor that happens prior to the maturity time of the pregnancy. So the preterm labor may include, regular contractions that occur every 10 minutes or more frequently, and changes in the vaginal discharge, pelvic pressure, back pain, cramping. So if the mother experiences any of these symptoms, it really would be essential for her to contact the doctor immediately. The doctors may recommend complete bed rest and certain medications to stop the contractions at this stage. And any other medical interventions might be done to help avoid preterm birth. And there are several factors that can increase the risk of preterm labor. That includes a history of preterm labor or premature births, carrying multiple babies, such as twin or triplets. Some infection can cause this. High blood pressure and certain medical conditions can also lead to preterm labor. However, in some cases, preterm labor can occur without any apparent cause, and preterm labor can lead to several complications for both mother and the baby. And for the mother, these may include infection, heavy bleeding, and increased risk of cesarean delivery also. And for the baby, the complications may include some respiratory distress syndrome. This is a condition in which, baby's lungs are not fully developed. And low birth weight is also one of the complications that can occur due to this preterm labor or preterm birth. And an increased risk of development delay also is there. Fortunately, some steps can be taken to reduce the risk of preterm labor, and this may include receiving regular prenatal care and avoiding, let's say, smoking, drinking, alcohol, and maintaining a healthy pregnancy weight would also help in avoiding risk of preterm labor. Round ligament pain is another common issue, and many women experience this during the second trimester as the pain as the uterus expands. So this pain is usually mild and can be alleviated with just gentle stretching also. So the round ligament is a band of tissues that connects the uterus to the groin area. So as the uterus grows and expands during pregnancy, the round ligament stretches and may cause discomfort or pain in the lower abdomen or the groin area. This pain can be felt in one or the both sides of the body or the abdomen region, and can vary in intensity from woman to woman. While usually, round ligament pain is generally considered to be a regular and a common occurrence during pregnancy, sometimes if it's too much or too uncomfortable, then mothers can contact their doctors if required. And however, there are, if it's a general abdomen pain, there are several ways to alleviate that by just gentle stretching, and sometimes moving also slightly helps with easing with the ligament pain. And in their prenatal yoga plays a very beautiful role. Even sometimes going to simple walk can really help to strengthen the muscles and increase the flexibility in the abdominal muscles. Sometimes taking warm bath or using heating pad on the affected area can also provide relief. And it's really important to note that, while the mild round ligament pain is really normal, but if, again, it's severe or persistent, then it might be a sign of a more serious conditions, such as a urinary tract infection, or sometimes also a sign of preterm labor. So if the pain is severe, we need to take it seriously, and have, if they have any more symptoms arising, then we have to contact the doctor or the healthcare provider immediately. And in addition to sometimes or doing yoga and walk, etc., one another thing that can really help mothers with the round ligament pain is supporting their belly with the belly band, or the maternity belt, it's called usually. That personally helped me a lot. The maternity belt really helps you, especially if you're doing yoga or walking, wherein the belly moves up and down. If you wear a belt, that really supports, gives a huge support to the belly to stay at a certain place, and that also avoid any risk of excessive skin stretching, and that really helps. So while the women mothers are coming for yoga classes, you can recommend them to wear a maternity belt or belly band, and that can really support them while practicing asanas also. Now, another thing is, if they also stay hydrated and also get plenty of rest during the day and maintain a good posture, this can also help them with the round ligament pain. Now, during this time of second trimester, the weight gain can also occur, which can, unusual weight gain, too much weight gain. But that is due to maybe if not, the mother is not taking correct diet, or she is, maybe experiencing too much stress and doing anxiety eating. All that can also lead to too much maternal weight gain. That should be avoided. Varicose veins is like when she has a swollen, twisted veins due to the increased pressure, That is also another condition that can occur in second or third trimester. In the second trimester, since the baby starts to grow and the belly weight increases, back pain is another common issue that is noticed. But if the back pain is seen or there is intense back pain with other symptoms, that might be a symptom of some other serious condition. But if it's general back pain, that should be managed with postural changes or just general, maybe some yoga practices, some cat cows, and some spinal plexus. All this can really help ease with general back pain that occurs or begins to start or begins in the second trimester. Coming on to the third trimester. Now, coming on to the third trimester, so third trimester of pregnancy encompasses of week 28 to 40. And this marks as a final stretch before the childbirth, and it's usually characterized by many physical changes and preparations for the labor and delivery. And during this period, the mother's body continues to undergo significant transformation to accommodate the growing baby, which can bring about a new set of symptoms and challenges. And one of the most prominent physical changes during the third trimester is the rapid expansion of abdomen as the baby grows in size. And this can lead to increased discomfort, including backaches, pelvic pressure, difficulty sleeping due to sheer size of belly. So as the uterus expands, it may also put pressure on the bladder, leading to more frequent urination. In this addition to this, the physical discomfort, many women experience, a lot of emotional fluctuation also during the third trimester, and there's a lot of anxiety about delivery and labor also in many women at this point in time. And also, as well as beyond the anxiety and delivery, they do also have excitement of meeting the baby at this stage, and so those emotions can also really arise a lot. And some women may also experience a sense of impatience as they await the arrival of their little one. So impatience is also a very common phenomena during the last trimester. And as the due date approaches for the delivery, it's important for the mothers to really pay close attention to the sign of labors. And this might sometimes include regular contractions, the rupture of amniotic sac, or that is called water breaking in normal terms. Sometimes there is some blood spotting that is called as mucus tinging. There's the mucus wall on the vagina that breaks, which leaves slight pink sort of spots or blood spots, and that should also be watched for. And it also becomes essential in this trimester to be able to differentiate between false labor and true labor. So false labor is also known as Braxton Hicks. So Braxton Hicks contraction are common phenomena during this third trimester. So the true labor contraction, which really signifies that the child is going to be born, are different and regular as compared to Braxton Hicks or false contraction, which occurs in, let's say, quite different periods, let's say once in 1 hour or 2 hours, and then they are gone, and they don't occur after, let's say, another 1 hour. But sometimes women do experience that it's happening every half an hour. But if the time is not reducing, usually that signifies that it's most likely false labor. What I mean by time is the time between the contraction. So in an ideal true labor, the time of the contractions decreases. So for example, if it began with 1 contraction in 1 hour, it reduces to 1 contraction in 40 minutes, 1 contraction in 30 minutes, 1 contraction every 10 minutes, and so on. 1 contraction every 5 to 1. That's how intense it keeps getting. So, but usually in hits or the fake labor, it's not like that. The time doesn't reduce. It will happen once in every 1 hour, and it might not change. So that is usually a difference to know whether it's true labor or the fake labor. So during this time, the prenatal care becomes also very, very important. That's where we need to monitor the baby and the mother's health very, very regularly. Regular checkups also increase with the doctors. Doctors begins to track fetal growth a lot more and evaluate the baby's position in the uterus also at this stage, and they also assess mother's overall well-being quite often during the third trimester. And in some case, additional ultrasounds and some non-stress tests are also conducted to ensure the progressing of the mother well. What is required in the third trimester? So first would be nutrition and self-care, which always remains a crucial aspect of pregnancy, and it becomes more crucial in third trimester. And adequate, because this is the fastest time of growth for the baby. Mother also increased the weight quite rapidly at this stage. So really ensuring that increase of weight is healthy weight. So that means the weight is not coming out of eating junk, etc., but proper nutrients and proteins, calcium, iron, etc. Everything, all kind of nutrients is taken care to support the baby. Many women though we'll discuss this about in the nutrition chapters, but DHA EPA is an essential component, that is omega-3 acids, a very essential component of the mother's and of the health of the baby. So baby's mind and brain really develop fast if we introduce DHA and EPA supplements, the omega-3 supplements, at the third trimester especially. So though women can take their personal guidance from their doctors, but most doctors do not really personally advise supplements. So if they opt for, let's say in general, omega-3 supplements for the baby, then they can just confirm from their professional doctors that if it's okay. Usually it is, if they don't have any underlying medical condition. But introducing that, especially in the third trimester, will really help the brain development of the baby a lot. Maintaining the hydration also becomes quite crucial at this stage, and continue to engage in gentle exercise and activities will help the mothers to elevate any discomfort associated during the last trimester also. Sometimes there is constipation and swelling that shows up in this trimester. That can also be elevated with if the mother is active and hydrating herself well. Now, as the due date comes near, the mothers should also begin to finalize their birth plans and preparing for the labor and the delivery. This might involve attending birth, childbirth education classes, and packing their bags if required, and discussing any pain management options at this point in time with their doctors. Additionally, they can create some support network of family and friends that can provide emotional encouragement during this point in time to really help them deal with whatever symptom might arise or whatever conditions they will go through at the time of delivery. So while third trimester is there, it can really bring its own share of physical and emotional demands also, and which are related to arrival of the new child, and so mostly the parents are too much joyful, and they're preparing for the birth of the child, but it can cause some anxiety also at times. But that's part and parcel of being parents. Apart from that, discussing the conditions that are there, first would be preeclampsia. The preeclampsia you have understood in a nutshell, but this can be a very serious condition that can develop during the third trimester, and it's characterized by high blood pressure, swelling, and protein in the urine. So usually doctors check the level of protein in the urine a lot during the third trimester, because if there are any symptoms where the protein is high, and then it can further lead to any complications for the mother and the baby if not managed properly. So preeclampsia is potentially life-threatening, and this condition can affect 5% of the pregnancy all across the globe. So it is not fully understood what causes preeclampsia yet, but it is thought to be related to the problems with placenta, which can cause damage to the blood vessels in the mother's body. And the symptoms of preeclampsia may include high blood pressure, swelling in the face, hands, feet, constant headaches, changes in the vision, and of course high amount of protein in the urine. But it needs to catch the symptom faster, because this leads to damage quite faster, as we can't even contemplate by that time it must. So that is why being constantly aware of your body, and if anything can potentially feel dangerous, women really needs to contact the doctor immediately. And if the preeclampsia is left untreated, it can lead to severe complications of both mother and baby going into seizures or stroke, or liver or kidney damage, or premature birth also at times. And if preeclampsia is diagnosed in time, then it becomes essential to manage the condition very carefully to minimize the risk of further complications. Sometimes doctor may recommend complete bed rest or medications to lower the blood pressure, and they will usually closely monitor the baby's health very much. In severe cases, the delivery may be necessary even if the baby is not yet fully formed. There are several risk factors for preeclampsia, including the history of preeclampsia in previous pregnancy. High blood pressure, diabetes, and certain other medical conditions can also lead to preeclampsia. And women who are carrying multiple babies or have a family history of preeclampsia can also be at risk of preeclampsia in their current pregnancy. The next condition is fetal distress. Fetal distress is a condition that occurs when the baby is not getting enough oxygen or nutrients. And it is caused by a number of factors that includes placental problems and umbilical cord issues. So the umbilical cord is a cord that is connecting between the placenta and the baby. So the baby's navel is connected to the umbilical cord, and the cord connects directly into the placenta, which is storing the nutrients for the baby to survive inside the womb. So it is really crucial for fetal distress to be identified and treated promptly, and it can lead to severe complications for the baby. So there are several signs and symptoms that might indicate fetal distress, including changes in the baby's heart rate, decreased fetal movement, and meconium in the amniotic fluid. That can be tested if mother reports any issues. Meconium would be tested for. If the excessive meconium is there in amniotic fluid, that is a sign of fetal distress. So the fetal distress is really suspected. Whenever suspected, might require an immediate medical attention, and to really know the real cause which is causing this. Now, placental problems, sometimes like placenta abruption or placenta previa, can interfere with the delivery of oxygen and nutrients to the baby. And umbilical cord issues are there, such as it's called a nuchal cord or a compressed cord, can also restrict the blood flow and cause the fetal distress. So sometimes the umbilical cord goes around the neck of the baby, which causes, the baby can't breathe properly in these kind of situations. So all these situations can occur, but there is no way that the mother would know until she is so aware of her own symptoms in the body and could feel that baby is not moving, etc. So all this one needs to be aware of to really know the fetal distress in time. Maternal health problems can also cause this sometimes. For example, high blood pressure or diabetes can also contribute to fetal distress. And in some cases, fetal distress may occur without an apparent cause. And if fetal distress is really suspected, it's really, vital to take action promptly to protect the health and the well-being of the baby. And depending on the severity of the condition, the treatment might involve, oxygen therapy or intravenous fluids and medications to promote the fetal lung development. And in some cases, the delivery may be necessary to alleviate the fetal distress and prevent further complications. And this might include either they might induce labor sooner. So inducing labor means they are artificially inducing labor. And how medical professional does that is by inducing the oxytocin hormone in the body of the mother, which gives signals to the mother's body that it's ready for delivery, when it's really not, but that's what is called inducing labor. It is done usually at the time of the delivery to ease the mother's pain, but it is also done prematurely in certain medical conditions such as fetal distress. Sometimes performing C-section is also the solution to the fetal distress. Sometimes using forceps or vacuum extraction to facilitate the delivery might also be required in order to let go of the fetal distress. Next is Braxton Hicks. We have briefly discussed about it. We'll just review it quickly. So they are commonly experienced by many women in the third trimester, and there are often, the contractions can feel tightening and hardening on the uterus, which is like a normal contraction. And so while, Braxton Hicks or the fake contractions are generally harmless, but they can be uncomfortable and may cause some discomfort and pain to the mother. And these contractions may occur at irregular intervals, as discussed before, and usually go away on their own. And so it's really, once again, becomes very essential for the mother to distinguish between the true and the fake labors, and also the preterm labor, because sometimes it might not be that false labor or Braxton Hicks, but it might be really that the baby is coming sooner for maybe some underlying medical condition or some complications. We don't know. So we really need to know the difference between the contraction that happens, which is like fake contractions, Braxton Hicks, and the contraction that happens during the preterm labor. So preterm labor, is defined as the labor that begins before 37 weeks of pregnancy. So if the labor signs are shown prior to 37 weeks of pregnancy, we can consider that as a woman, the body is at risk of preterm labor as well. So there are several signs and symptoms that might indicate preterm labor, including regular contractions that occur every 10 minutes or less. There's a lot of pelvic pressure, vaginal bleeding, and the fluid leaking from the vagina. And if these symptoms occur, then it's, of course, very vital to have immediate medical attention. though that we have discussed about the preterm labor. So there are no fixed causes, but there are underlying medical conditions, infections, sudden infections, placenta previa-like conditions can cause preterm labor. So if that happens, then the doctors will take their proper measures. But usually, if the contractions are happening after 37 weeks, then we don't need to worry about whether the contractions are of preterm labor or of Braxton Hicks. But what we need to differentiate then also in the 37th week is whether they are Braxton Hicks or whether they are true labor. So again, if the contractions are irregular without any other symptoms such as leakage of amniotic fluid, etc., then they are more likely to be fake labor. Otherwise, if after 37 weeks there are constant contractions, reducing in time, and are regular, and also there are other symptoms, let's say mucus plug coming off and slight blood spotting, etc., then they all might be the sign that the labor has begun. Next is pelvic pain. During the third trimester, like many women experience pelvic pain as the baby drops lower to the pelvis, getting ready for the birth. And this pain can be very uncomfortable and debilitating for some women. Some gentle exercising, stretching can elevate this pain, and pelvic pain is usually caused by the weight gain and the pressure of the baby on the pelvic floor muscles and ligaments. And as the baby gets lower into the pelvis, it can put more pressure on these muscles and cause pain. So gentle stretching can really help loosen these muscles and reduce pain. At the same time, the Kegel exercises can also help in elevating pain. And Kegel exercises, which is contracting and relaxing your pelvic floor muscle. We have a separate chapter on how to practice all of that and importance of it. So basically, this will help strengthen the muscles and help manage the weight of the baby and reduce pain and discomfort. Coming on to, there are very other common issues that can happen at any point in time of the pregnancy. So the first would be breathlessness, which is a common symptom common issue that arises due to growing uterus, putting pressure on the diaphragm, lungs, reducing the capacity of lungs to expand and leading to the shortness of breath. And this can be exacerbated by certain positions, including lying on the back for an extended period. In such a position, the uterus puts pressure on the vena cava, which is the large nerve in the spine, and it's the most prominent vein in our body. And this restricts the blood flow and oxygen to the mother and the baby, and that also can cause breathlessness. And sometimes also cause dizziness or fainting. Breech baby is another condition that occurs. So breech baby is a condition where a baby is positioned with its feet or buttocks presenting first to the vaginal opening instead of the head first at the time of delivery. And this position can lead to complications during delivery, and therefore doctors usually encourage the baby to turn the head first position before the delivery. Squatting during prenatal yoga practice can put pressure on the uterus and may encourage the baby to remain in a breech position. So we need to avoid squatting if we know that the breech baby condition is existing for the mother. If the baby is in breech position after 35 weeks, then it is recommended that squatting is to be completely avoided in prenatal yoga practice until the baby has turned upward. So the mother should really communicate to their doctor and the prenatal yoga teacher that certain modifications may be required in their yoga routine also. Next is carpal tunnel syndrome, and it's also a common nerve condition that affects the wrist and the hands. And it occurs when the median nerve, which runs from forearm to the hand, becomes compressed. And this compression can cause numbness, tingling, and weakness in the hand and the wrist. And pregnant women are at high risk of developing carpal tunnel syndrome due to hormonal changes and fluid retention during the pregnancy, which can increase pressure on the median nerve. Additionally, it's important for a woman to inform her yoga teacher, that her condition is there, and such that, you as a teacher can modify the postures whenever required to accommodate her needs. And you can also suggest some alternative postures whenever there are postures which requires them to put a lot of pressure on the wrist. Next condition is cervical stitch, and in cervical stitch, a woman should avoid full squat positions while practicing prenatal yoga. So a cervical stitch is also known as cervical circlage. It's a surgical position that is performed during the pregnancy to prevent preterm delivery, premature delivery, you can say. In this procedure, a suture is placed around the cervix to hold it close and prevent premature dilation. A cervical stitch is usually recommended for the women who have history of second trimester loss of baby in past, or who have weakened cervix. So therefore, it is recommended that the women with cervical stitch to really avoid full squatting position and instead offer more gentle yoga practices and do not put any excessive pressure on the cervix at all. So some postures that we can do is in seated twist or seated forward gentle bends or very gentle hip openers, but not squatting. And it's also important that women with surgical stitch has to inform the yoga teacher such that you as a teacher can really accommodate her needs. So here, once again, it becomes very critical for you to know the medical conditions of each woman practicing in the class. Hence, having some sort of medical condition form where they can inform you about different kind of conditions they have will be really helpful, and constantly updating them during the pregnancy will also really help you to modify the yoga practices for each mother. Next condition is hemorrhoids. And hemorrhoids are swollen veins in the rectum and the anus, and that can cause discomfort in the pain. So they are common condition during pregnancy, and they are caused due to increased pressure on the pelvic area from the growing uterus. So full squats in yoga that requires them to involve their lower body as far as possible, and then returning to the upright position. This pose can, these kind of poses can put a significant amount of pressure in the rectal area, which can worsen the symptoms of hemorrhoids. So women with hemorrhoids should avoid squatting positions even while practicing yoga postures. Next condition is symphysis pubis. So it's also known, in short, we call it SPD. So this is a condition that affects some women during pregnancy and is characterized by pain and discomfort in the pelvic area. And this condition can be caused by hormonal changes and increased pressure on the pelvis during the pregnancy, and can make it difficult for women to participate in physical activities and do any kind of exercise. So Instead, these women who have SPD can really focus on poses that help them release tension and discomfort from the pelvic area. Maybe small, simple postures such as cat-cow and child pose and butterfly. And they can also use props such as blocks and blankets to modify the postures whenever required. Diastasis recti is also another condition that affects some women during pregnancy. This is a condition in which abdominal muscles separate along the midline of the belly, and this condition can cause weakness and instability in the abdomen area, and this also increase the risk of low back pain and musculoskeletal issues. Another would be varicose vein, where the veins are swollen and twisted veins that occurs when the blood pools in the veins and puts pressure on the veins wall. So this can really cause a lot of discomfort, pain, and swelling in the legs. Varicose veins are more common during pregnancy due to increased blood flow volume in the body and the pressure of the growing uterus. So for the women with the varicose vein, we can avoid postures which require them to stand for a long time, and that puts a lot of pressure on their legs. So that can be avoided, and we can just first focus on relaxing their nerves and veins more. Sciatica or sacroiliac pain is another common symptom that causes low back and leg pain during pregnancy. So sciatica occurs when the sciatic nerve, which runs from lower back to the legs, is compressed and irritated, while slip disc also occurs when so slip disc is also common and can occur simultaneously or at different points in time for different mothers. And slip disc occurs when one of the intervertebral discs of the spine bulges or ruptures and puts the pressure on the spinal roots. Now here, if any of those conditions are there, we will need to modify certain posture accordingly. We have discussed this in detail in the other conditions chapter. IVF pregnancy is another one, and IVF is a process by which eggs are fertilized with the sperm outside of the body in tube, and that results in embryo then further implanted into the uterus artificially. So IVF pregnancy can be a very delicate process, and it's really important to take a lot of precautions to ensure the health and the safety of the mother and the developing baby. And the women who have conceived through IVF is really advised that she only starts to practice asanas, yoga or prenatal yoga after the 5th month of pregnancy to make sure the pregnancy is well settled. And this is because the first trimester is a very critical time of development for the baby, and any physical activity that is too strenuous can increase the risk of miscarriage for the mothers. Fluid retention or edema is another common condition during pregnancy, where our body accumulates excess fluid, leading to swelling of hands, feet, and ankles. And this condition can really cause discomfort and even pain, and can make it worse to do certain physical activities. Some yoga postures can also put a lot of pressure on these areas. And therefore, the women experiencing fluid retention and edema during pregnancy should avoid any yoga asanas that causes them discomfort or increase the swelling in any manner. So usually standing posture or warrior poses, tree poses, etc., put a lot of pressure on their legs and feet. So all of that can be avoided, and we can do more of the sitting asanas, stretching, gentle stretching, relaxing, more yoga nidra, etc. So so we can focus on poses that promote circulation and alleviate the pressure on the affected area. Some gentle twists and seated forward fold, etc. can help during this time. So with that, I really hope this was insightful for you, and you understood the importance of knowing the underlying condition and how certain symptoms can be interlinked with a serious underlying condition that can be damaging for the mother's and the baby's health. So being aware of this even smaller symptoms such as headaches, etc., co-joined with other more symptoms. So all this. So if you're aware of these conditions, you would catch right in time for the mothers going through any serious conditions, and can probably advise mothers also to consult the doctor immediately whenever required. So I hope this was helpful. With that, thank you and namaste.